All right. Thank you, Dr. Hencke, for joining me today. I'm calling my little segment Manifesting a Safe Stage 3 Opening. Now that we are doing Stage 2 opening, so we can have outdoor activities and, restaurants can open up a little bit more, the next stage is going to be Stage 3 for gyms and salons and going and getting our hairs cut. So thank you for joining me. And I just wanted to, ask you a few questions on how you perceive us being able to get into those more close quarters type industries. So my first question is, well, tell us about your background as a physician.
Oh, well, I am an emergency physician. I retired at the end of 2017 after 43 years and 5 months in practice. That's quite a long time. So I'm old now. I loved it. It was exciting, and I sure miss it. It's a very intense field, and it came time to do other things with my life. But I was director of the emergency department of the old San Jose Medical Center, where you and I originally made contact, 1980 through 1996, 16 years and 11 months. And I was on the board of the Health Trust, so I have a background in medical philanthropy. But if you want to hear all the stuff I've done, we'll never get done with this interview. Right now, I'm just trying to keep track of things, and like a lot of old folks, I'm worried about my own health.
Right, exactly. And you still talk to physicians that are still on the floor?
Yes, I do. In fact, one of my friends, almost positive he had COVID. He's a primary care doctor, works as a hospitalist at the hospital. He lost his sense of smell and taste and felt like he had a really horrible case of the flu, just felt like death on a cracker, and spent 3 days in bed. He never got tested, but then he started volunteering to take care of the COVID patients because he figured he was safer, because he figured he'd already had it. He's a relatively young and healthy guy, mid-40s, because a lot of the physicians were worried about taking care of him, just like when I was young, people were worried about taking care of AIDS patients.
Right. So what is the big deal about COVID, especially since the ratio of people who have it and are dying from it is so low given our larger population? Why should we care?
Well, for one thing, it's a highly infectious virus, and we don't know if we can get rid of it. There's a lot of things. The list of what we don't know is longer than the list of what we know at this point in time. For instance, at USS Theodore Roosevelt, the ship that had all the COVID positive sailors, just had something like 14 to 18 sailors turn positive again after they had had 2 negative tests and been discharged from sick bay and were considered cured. Then they started getting symptoms again and tested positive all over again. So the problem is we do not know if antibodies confer immunity at this time. We know people can develop antibodies. We don't know if they confer immunity. We don't know what the significance is of people getting sick again after they were declared well. So there's a lot we don't know about this virus. The death from COVID is a particularly ugly death. It takes a long time to die, and people suffer a lot because they drown from the inside out due to fluid building up between the alveolus, the little air sac, and the blood vessel that's supposed to absorb the oxygen. They just become progressively short on oxygen. We don't know how to control it. Well, we do, but we miss our chance. A place like Taiwan controlled it. They knew something was going on in Wuhan at the end of December. They started screening all flights from China. They employed strict protocols for following the patients and contact tracing, and so did South Korea. And that's one reason they were able to control the virus relatively well without the social distancing that we've had to employ, because they were right on it from the beginning. They knew everybody that had it. They knew everybody who'd been in contact with them. And they did that early. It's too late for us to do that now. It's escaped, it's in the general population, and we have, lots of local spread all across the country. So dealing with it now is very difficult. It's out there, it's on the rampage. We don't know if a vaccine will work. There's some promising reports. We don't know if a vaccine will work. We don't know if herd immunity will work, because we don't know if antibodies confer immunity. So we don't know if any or maybe a subset of people can become immune. So this leads to a lot of imponderables, and what people who own businesses that are going to try to reopen in phase 3 are going to face is people who are skeptical about their own safety, irrespective of what the government is telling you people, especially people in certain subcategories, are going to be voting with their feet as to whether or not they do business.
Right. So how do close quarter businesses open? Like me as a massage therapist, chiropractors, some chiropractors have been working the whole time, but as they open their doors to more clients, how can we protect ourselves as well as our clients and our entire office? Because a lot of us share space with other providers.
That's problematic. That's problematic. Closed spaces are inherently dangerous. Your two main modes of transmission are through the air, droplets or aerosol, and surfaces, touching surfaces. So we all know the thing about not touching our faces and all that kind of stuff. One thing, the promiscuous use of gloves without regard to contamination is a real problem. I just want to throw that out there. People think gloves are magic, that they kill germs. They do not. They're just like your hands. They pick up germs, they transfer them to other surfaces, and unless you change your gloves after every time you touch something, you're not doing yourself any favors by wearing gloves. You need to disinfect your hands frequently. Hand sanitizer is good. The best thing is old-fashioned soap and water, which is hard to do frequently. So one of the big issues is air circulation in a closed space. One of the most effective ways of keeping people safe is having an exhaust fan that sucks all the air out of the enclosed space and blows it outside. You think about 6 feet is an arbitrary guideline. In Europe, they say 2 meters because they're metric. You can be 3 feet away from somebody without a mask, but if you're outdoors and the wind is blowing, you will not be breathing what they're exhaling, and you may be perfectly safe. On the other hand, you may have a mask and be 12 feet downwind from someone who's huffing and puffing in an exercise class and still have some chance of inhaling the virus. Because remember, the mask is mostly to protect others from what you're expectorating or breathing out, not to protect yourself. Right. The masks we commonly wear are not N95. Try on an N95. After a while, you'll feel like passing out. I mean, you just can't hardly get any air in and out of the thing. I've tried.
Right.
So these masks that we wear out in public are mostly a courtesy to others, but they are very important. Another thing about masks and closed spaces, the study I saw recently showed, and the numbers I'm going to throw out are approximate. Okay, let's say you have 2 people sitting in an enclosed space, 3 feet apart, talking to one another. And let's say one of them has got COVID. So give them 15 minutes of doing that, and the chance of the uninfected person picking it up it's pretty high. Let's say 50%, just for argument's sake.
Wow.
You put a mask on one of those 2 people, either one, and your probability will, preferably on the one that's got it, will drop significantly, maybe 25%. Put masks on both, 5%. So what we're really talking about is a scaled risk. There's no such thing as zero risk. So you want to have proper spacing, you want to have air circulation, and you would like to have everybody obeying the same protocols. If you have a bunch of unmasked people coming into a place where only half of the people are wearing masks, that wouldn't look very safe to me. Right. I would be very sketchy about that.
Right. And I just want to back up when you said the 5%. So if both people are wearing a mask sitting in a room 3 feet away, the chance of them catching COVID is 5%?
Well, that's approximate from one study. Okay. And you got to be careful about citing one study. You don't know how well it was done.
Right.
You don't know if the results are reproducible. But so these are just gross approximations to show people that it's a scale of risk. There's no black, there's no white, no true, no false. It's just all a scale of risk. To the extent we go back into this, and the kids are out of school, it's bad for the kids. People are not getting money, they're not getting fed. So we're beset with conflicting imperatives here. We can't just keep the economy shut down forever. Right. But the fact that we don't have a vaccine, we don't know if there will be such a thing as true herd immunity at this point, indicates that reopening should be done cautiously. A lot of places that have reopened are already experiencing surges. And it's possible that in the worst case scenario, if there is no true immunity, then maybe a lot of people will eventually get it.
Right.
But you would like to defer that point as far as we reasonably can because we don't know what treatments or vaccines or preventative measures will come up in the interim that might keep us a lot safer a year or two down the road.
Right. So I've been reading some memos by other trades. So one was for ophthalmologists. And so, they do want the doctor to wear a mask and, the patient to wear a mask. But something that was included in there that struck me was minimalize talking. And so now I have been giving massage to my clients that have doctor's notes because it is a medical need. And I noticed that when we're talking, my mask is moving around all over my face. At some point, I feel like it's covering all of here, and I'm constantly adjusting my mask. And what I've learned is adjust it from the bottom and not from the top. What are your thoughts about that of not talking? It's hard not to talk.
Those are very important points. I'm glad you brought that up. Another point about masks is the ones that have straps in the back of the head, even though they're a little more inconvenient, fit better. I've noticed I got one of those for our last trip to the grocery store, and it wasn't fogging up my glasses as much, which means that this big nose of mine wasn't stenting it open as much, and there was less air going in and out through the free spaces through which I also could expel or inhale a virus. So those are a little bit more effective. But with regard to, where were we going?
Oh, just the non-talking while wearing a mask.
Okay, epidemiological mapping is something we need to use a lot more of. I don't know if you've seen these maps. So this started coming to light when you had a choir. I forget where they were. They had choir practice. They did all this screening beforehand. They did personal sanitation measures. They spaced the members of the choir apart, and most of them got COVID because one person had it. When you sing, you're projecting your voice, right? You want to project it as far as you can. So you're going to expel a lot of air. So these people were expelling lots and lots of droplets into the air, and they went far beyond 6 feet. Right. And they've done I think there's one other choir where almost all of them got it. And the only people that didn't get it were in the front row, catty corner away from the person in the back who had the COVID. So this is extremely important. That's why, for instance, if I'm outside and I'm on a trail and a jogger or a walker is passing on my left, if the wind is blowing from the right to the left, it's going to blow their exhalations away from me. I don't worry if I pass close to them. But if the wind's blowing the other way, I'm going to keep my distance, and I also instinctively inhale like I do if I'm passing a smoker, because I hate smoke, and don't breathe until I would be out of the plume of their exhalation, because I don't want to breathe whatever they're exhaling. And although that's a small risk, these variables are very important, because if you're huffing and puffing, that, and there's a wind blowing, that plume could go an easy 20 feet,
right?
Of whatever you're exhaling.
Right.
So, like if I go outside for exercise, I'm trying to avoid narrow trails where I can't pass someone easily on the trail. The last time I did that, I'm looking at staring down a cliff to get to the side of the trail so this person can get past with even minimal, adherence to social distancing. And I thought, that's pretty sketchy. I think I'm going to wait until the pandemic has passed until I get on a trail that narrow again. Right. So that's very important. The more you talk, the farther you're going to blow that virus if you happen to have it.
Okay. All right. That's good to know. Thank you. And I too hold my breath. Like if I'm in the supermarket and someone coughs, I do one of these, and just kind of like, okay, let me just get farther away from you before I inhale again. I thought I was being OCD. I feel like one of my clients is OCD, and she came in, she's wearing her mask. She wore her mask the entire session, 90-minute massage. And I told her, she always got a lot of flack for being OCD, and I do too. And I said, don't you feel vindicated right now for your ultra clean ways? You're just uber, everything's in its place and everything is immaculate kind of a way. And she says, girl, if you only knew the half of it. So thank you. I'm glad that I'm not creepy when you said you hold your breath when, depending on which way the wind is blowing, and especially if someone coughs too, that exhalation.
It's all about relative risk. Risk. There's no zero risk. You want to minimize your risk, and it's also a dose versus response relationship.
Right.
A lot of people, if you just get a small dose of virus, your body's going to take care of it. Your natural defense mechanism will clear it. But if you get a high dose, that's why these healthcare workers are at such risk. They have a slightly leaky mask. It might not matter for 15 minutes, but for an 8 or 10 hour shift, with all the heavy breathing you're going to be doing, with whatever you have to do. I mean, I'll tell you, in the ER, if I'm intubating a patient and I'm running around the bed, with a critical case, I'm going to be breathing a little bit heavier than if I'm just sitting there and interviewing you about your abdominal pain. So that's one reason these people are getting sick. They're in a high virus environment, but I also want to emphasize that the hospitals are doing a damn good job keeping things clean for people to come in there.
Exactly.
Healthcare, a lot of it's dying on the vine because of the cancellation of elective procedures.
Right.
And they're canning doctors and nurses and techs because people aren't getting their colonoscopies and the routine care. And you got people who are not coming in because they have a stroke, which might be able to be fixed with intervention. And they're afraid to come in, and then now they're stuck with permanent paralysis that we could have treated.
Right.
So this is really a double-edged sword.
It is.
Because people are staying away from healthcare that they badly need because they're scared of COVID. And the hospitals are doing a good job.
Yeah, they are. One of my clients is a nurse, and she reached out to me, just dying. She works in the NICU with the babies. And, she said that, when all this first started, people were coming in with whatever complications or whatever. And then once they were in the hospital, that's when they started presenting, symptoms. And of course, at the beginning, they have no idea what's happening, what they're working with. And then, the tests took so long for the results to come back, and then, she was expressing to me the anxiety of, dealing with something new, which I know that you can relate to in regard to the AIDS thing. Is like, what is this that we're working with? What are we supposed to do? And heaven forbid I get sick. She's a single mom, divorced, 2 kids. One is a quasi-adult and the other one's still, a teenager. It's like, what would happen if something were to happen to her because she's working with the unknown?
Well, I mean, in my family, there's a dilemma. I got 5 grandkids. They're all little, but, some of them need to be in preschool or in kindergarten or whatever. You can't do that online. You can't Zoom a kindergarten class. And then one of my kids has a slight genetic problem and her immune system might not be quite up to snuff, but she needs a socialization at least as bad as the other ones. What do you do? My daughter is having such a fit trying to decide the right thing to do. Right. There's no zero risk thing. Keep the kid out of school. Her development is retarded. Right. Put her in school, there's a slight risk she could catch it. Most kids do well. Some kids get this multi-system inflammatory syndrome and don't do well.
Right.
And we don't know if it's their genetic background. There's just so much we don't know right now.
Exactly, we don't.
So all these risks need to be mitigated to the extent we can. So I think good air circulation, spacing, and masking indoors is really important. I'm going to shut off my phone.
Okay, and that leads us to the next question, which is gyms, yoga classes, CrossFit. How do we ensure safety in those kinds of places?
Well, one general and one specific comment. I mean, in general, you need good air circulation and good spacing. The whole scenario where you got, 20 people sweating on spin bikes, puffing and puffing next to each other, just isn't going to fly until we do have herd immunity and or an effective vaccine. But if you have people, just a few people, well scattered out with good air circulation, your risk is minimal.
Right. I used to go to Forma Gym, and Forma has an outdoor area. And that was one thing that I enjoyed about going to that gym was the ability to take my workout outside. So I think gyms like that will probably flourish now while everybody else has to figure it out, maybe take out some machines or at least put the caution tape just to make sure that people aren't right next to each other, like you said, sweating it out on the treadmill or the
wiping down all the time, take care of the services.
Right.
Yeah. But I mean, bring back Muzzle Beach, right? Let's be pumping iron outside if we can. I mean, thank God we don't live in Vermont, right?
Right.
That's really a tough set of choices they have up there.
Right.
But you know, the more outdoors activities you can do, the safer you are.
Right.
You're not absolutely safe,
Right.
but moving air is very much in your favor. That's one reason indoor spaces are so vulnerable.
Right. And then my last question is just, manifesting, adapting. We spoke a little bit about AIDS before. I think the AIDS, that created change in that, the blood started being tested for AIDS. Just a quick story. I don't know if I've told you this, but, back in the 80s, my mom, she had a partial hysterectomy and she lost a lot of blood. So they gave her a transfusion. And so years later, she gets an email or a letter in the mail saying that she might have been given tainted blood. They weren't testing it for it back then. So one adaptation is hospitals and donation stations started testing for AIDS. But not only that, in the dating realm, I think people started asking each other, how many people are you sleeping with? When was the last time you got tested? So now we've got COVID. So how do we adapt? There's a lot of fear out there. There's a lot of misinformation out there. There's a lot of changing information. How do we get past our fear and just adapt to what is happening right now from real news sources?
Well, that's kind of hard because it doesn't look like the nation's all dealing with the same set of data. We need to really be dealing with the same set of facts, or it's kind of hard to make progress. Unfortunately, the nation is turning into a large open-air testing lab as we irregularly march towards reopening, even in states who have an increasing count of cases and deaths. So we're going to have to feel our way through this thing. You're going to have to take incremental precautions until we get more science so we know exactly where the risks lie. Now, I think it's going to be important going forward to use the small tools that the epidemiologists have used and used to greater effect in other countries, which we're having trouble employing because our problem is so massive, because it was allowed to get out of control during the first few months of the year. That is, looking at where the outbreaks occur, interviewing all the people that participated in that scenario. Where were they sitting? Where were they standing? Who got it? Where did it originate? So, for instance, if you do have an indoor business where you see some spread, get the epidemiologists in there, map it out, see where it came from and how it spread, because there's a lot we don't know about the exact mechanism of how this spreads in an indoor environment. And by studying those things, especially as you start to get people back in the stands for sports and this, that, and the other, we might be able to find some more intelligent ways to rearrange things, which will be both more effective and at least less inconvenient for both the people that are selling services and those that are purchasing them. But this is going to be an ongoing process, and it's going to have to require an open mind on both sides. We cannot stay shut down forever, no matter how much we believe in prevention. The kids will not do well out of school, and our kids and grandkids will pay the debt for the bad economy for many years to come. We've lost the chance to control it early, the way Taiwan and South Korea did. So now we need a more massive effort. We need the contact tracing. We need the testing so that we can fine-tune our approach as we reopen to try to minimize the risk. So this requires an ongoing epidemiological study.
And how long do you think it will take before we have the answers that we need to get back to normal as opposed to living our new normal?
Well, that depends on a number of things because, we're, as I say, trying to hit a moving target. The new messenger RNA vaccine by Moderna, which has received tentative good results in early trials, we'll know by the end of the year probably if that's going to be reasonably effective. We've never had a vaccine made by this mechanism before. That's why Dr. Fauci was saying 12 to 18 months for the traditional process. There's so many new technologies that are being employed. We don't know how reliable they are. We don't know what they're going to result in, but we have to try them. I would be so happy if we could have an effective vaccine by the end of the year. I really miss seeing my 5 grandkids. We can't count on it. If we do, it's a game changer. If not, we're looking at a longer course of action to see if we have an effective vaccine. But there's lots of research being done now, so I think we will know sooner rather than later if vaccines are possible, if antibodies confer immunity or not, and what's the deal about the relapses and how significant are they? A lot of these things need to be sorted out before the question you ask can be answered more intelligently.
Right, because it's still brand new. I mean, this is a manifestation of something else. You know, we've seen it, like you were saying to me earlier. You know, we saw it coming. You know, and it was just a matter of time before it would hit. You know, so it's like preparations were kind of being made along the way, and then we just kind of dropped the ball.
Yeah, the preparations had been made. I mean, if you listen to Bill Gates talk, and poor Gates is getting picked on, you know, he tried really hard to get prepared for this. He studied this topic extensively, you know, since he turned his interest to philanthropy. He's got a lot of interesting and good stuff to say about this. But as I said, we're not all dealing with the same set of data. So we have to experiment, doing various levels of effectiveness and see where it takes us. I'm hoping, at least here in California, we do assiduous contact tracing and try to manage the outbreaks in the way I was describing, because the epidemiological approach, while waiting for a vaccine and the other research to bear fruit, is the only thing that's really going to help us.
Right. Anything else you'd like to add about safely reopening for stage 3 businesses?
Well, I think you got to look at it from both sides. You know, the business owners has to look at his or her business and what they can do to ensure safe flow. You know, and there's lots of different ways people are trying to slice it. A small pack grocery store, for instance, is going to have a lot more trouble than one with larger aisles. Okay, so, and you have to look at it from the standpoint of the consumer. If the consumer walks up and sees one part of the office wearing masks and the other part not wearing masks and acting like they don't believe in the science, they're going to say, I'm not so sure about that. So I think one of the problems is a lot of people are so hesitant right now to do what we need to do to reopen the economy. They just don't want to come in the door. So They have to get the impression that everything is being done to assure their safety.
Right. And then as a provider, you know, how about when I have clients that come in and with no mask, or they say, that's okay, you don't have to wear a mask, I trust you.
Well, you can say you prefer to. Because how do you know you didn't contract the virus yesterday? Even the president's only tested once a week. He didn't wear a mask, he's exposed all the time. Because even though it's mostly to protect others, it also gives you some degree of protection.
Right. And
Every
I just heard
counts.
Yeah, go for it.
Oh, it's all additive. It's all additive.
Right. I just couldn't live with myself if I knew that someone that I saw personally contracted it, you know, and what if it led back to my office? So I'm all about wearing the mask, you know. Right.
So people are going to look for adequate spacing. They're going to look for the employees protecting themselves and others. Some people won't care. A lot of people will. And this is going to be the challenge we all face as we try to go through this process.
Right.
I think those businesses that can show a uniform and coherent approach, adequate spacing, and ventilation, and that's not emphasized enough. I really don't think that's emphasized enough, because moving air is a lot safer than stagnant air that you're breathing in over and over again. I think those things are going to be very important to give the customers a sense that their health is being safeguarded adequately.
Exactly. It doesn't do anybody good if we lose our customers to COVID.
No, and plus the word gets out, you know, people start getting sketchy.
Right.
I mean, there's a chain of grocery stores here where 2 of my kids work. One of the chains had 7 COVID cases. Thank God it's not the one where my kids work. But, you know, people notice that kind of thing. Right. We don't have too many outbreaks here in Little Santa Cruz County. That's another thing about relative risk. People don't really realize something I could do with relative safety here in Little Santa Cruz County, where we only have something like 165 cases and 2 deaths, would not necessarily be safe in Santa Clara County.
Yeah.
But there's a lot more people and a lot more people walking around who are virus positive and don't know it. Right. So this is why Modoc County, they don't need to be locked down. There's 9,000 people there. It's bigger than Rhode Island. You know, that's a whole different situation. This has to be a nuanced approach, not just by zip code, but almost by neighborhood.
Right, exactly. And tracking people's movements. You know, my mom, she's in Texas, and her community's first case was a college kid coming back, you know, to go to school. And, you know, back then they were telling people, quarantine, don't go anywhere for, you know, 2 weeks. And of course the girl goes and hangs out with her friends and goes to the restaurants and spreads it. Now they have, my mom messages me like every day, now they have 650 cases.
I don't know if you've read about what's going on in the Navajo Nation.
Oh,
They
yeah.
now are more COVID positive than New York City. One person came back from California or someplace carrying it. And
Right.
those people are so poor, they don't even have water to wash their hands with. So
Right.
how can they do adequate precautions?
Right,
You know, and now it's just sweeping through the whole reservation.
right, right. We could go on and on about.
We could. We could.
You know,
It's good to talk to you, Ramona.
It's so good to talk to you too. But thank you very much for taking the time out and joining me to talk about this. This is definitely something that I've been thinking about, you know, with all the groups that I'm part of and all the people that I talk to. It's like, how do we move forward? You know, let's and dampen down the fear, but use the fear as a means to ensure everyone's safety and that none of us lose any more people.
Right? And the thing is, there's going to be some more people lost. We want to minimize it. It's highly contagious, and, you know, it's more lethal than the flu. We don't know what the true mortality rate is yet.
Right.
But it's nothing to mess around with. Plus, the thought of dying and not holding someone's hand that loves you, these people die alone.
Right.
That is horrible.
Right.
That is one of the worst things about it.
Right.
Yeah.
Okay. Well, thank you for joining me.
But we need to be sober. We can't be freaked out. So your point's well taken. We need to be sober and use common sense about it. And that's the way to get through it together.
Exactly. Exactly. All right. Well, thank you very much for joining me. Thank you for joining me for my new pilot show, Manifesting, where there's a will, there's a way.
Yes,
And,
indeed.
I hope to have you back, hopefully on the other end of COVID-19.
I do look forward to looking at it from the other end, believe you me.
All right. All right. Thank you very much. You have a great day.
You too, Ramona. Take care.
You too. Bye.